Good morning. Today, let's talk about something most men tend to ignore until it becomes a significant problem. Something that affects a large percentage of the male population as they age. It's the prostate. This walnut-sized gland, often overlooked, sits snugly below the bladder, playing a crucial role in male physiology. It quietly and diligently supports male reproductive health, often without us even realizing it's there. It does this by producing seminal fluid, a vital component for healthy sperm function and fertilization. As men age, the prostate naturally grows, a process influenced by hormonal changes and other biological factors. And the reality is that nearly every man will face some prostate issue if he lives long enough. It's an almost inevitable part of the aging process. Ignoring symptoms, hoping they'll just go away, or skipping those all-important checkups can unfortunately turn manageable problems into serious ones, potentially impacting your quality of life. Proactive awareness, understanding your body, and paying attention to changes is your best defense. Know your risk factors, be aware of any family history, and talk to your doctor about any changes or concerns you might have. Symptoms of prostate issues often overlap, making it difficult to pinpoint the exact cause. So self-diagnosis isn't really possible. Seeking professional guidance from a qualified healthcare provider is absolutely essential. For example, frequent urination, especially at night, could mean a simple enlargement of the prostate, an infection within the prostate gland, or in some cases, even cancer. By understanding the prostate, its function, and potential issues, we can break down the embarrassment and stigma that often keeps men from seeking the help they need. Knowledge turns anxiety into proactive action, empowering you to take control of your health, and helps you make informed decisions, working in partnership with your healthcare provider. Over the next sections, we'll break down the 3 most common prostate conditions that affect men: BPH, or Benign Prostatic Hyperplasia, Prostatitis, which is inflammation of the prostate, and prostate cancer, a serious but often treatable disease. We'll cover what they are, delve into their specific symptoms, and explore today's range of treatment options, from lifestyle changes to advanced medical interventions. Your prostate health truly matters. It impacts your overall well-being and quality of life. And understanding it, learning about it, is the crucial first step towards taking control and ensuring a healthier future. Disclaimer: this video is intended for educational purposes only and does not replace professional medical advice. Please consult your doctor for any personal health concerns. Also, most videos on this channel, apart from the grammar content, have been created by gathering and synthesizing online knowledge that's available to the public. So, again, never use any part whatsoever of this channel content as medical advice. Let's start by addressing the most common prostate problem that men face as they age. It's a condition that, while not cancerous, can significantly impact your daily life and overall well-being. This condition is known as Benign Prostatic Hyperplasia, or more simply, BPH. BPH is simply a non-cancerous enlargement of the prostate gland, a natural part of aging for many men. This enlargement usually starts after age 40, often gradually and subtly. By age 60, it's estimated that half of all men experience some degree of BPH. It becomes increasingly prevalent with each passing year. And by the age of 85, BPH is nearly universal, affecting the vast majority of men. The prostate gland is strategically located, wrapping itself around the urethra, the tube that carries urine from the bladder. So as the prostate grows larger with BPH, it inevitably squeezes this vital tube. This compression makes urination difficult, leading to a variety of bothersome symptoms. It's important to reiterate that this isn't cancer. BPH is a benign condition. However, the urinary symptoms associated with BPH can seriously affect your quality of life, disrupting sleep, causing discomfort, and impacting daily activities. BPH is primarily linked to the natural aging process and changes in male hormones. Additionally, family history can play a role, increasing your individual risk of developing BPH. It's not your fault. You didn't do anything to cause it. It's a natural change that happens over time for many men, a part of the aging journey. You won't typically feel the growth of the prostate from the outside through self-examination, but you'll likely notice changes in your urinary habits, such as increased frequency, urgency, or difficulty starting or stopping urination. Recognizing BPH as a common and non-cancerous condition is an important first step. This understanding can ease anxiety and fear associated with experiencing bothersome urinary symptoms. The primary goal of treatment isn't necessarily to shrink the prostate back to its original size. Instead, the aim is to relieve the pressure on the urethra and restore more normal and comfortable urination. We'll discuss the various treatment options available to manage BPH in the next section. But remember, BPH is a manageable condition, and effective treatments are available. Don't let embarrassment or discomfort keep you from seeking medical help and discussing your symptoms with a healthcare professional. Understanding BPH and its impact is the first and most important step to taking control of your health and well-being. CTA, call to action. Check the description below to access other useful resources to accelerate your next medical language acquisition. Also, if you learned something from this video, hit the like button, share, subscribe to the channel, and hit the notification bell. BPH symptoms primarily revolve around changes in urination patterns and bladder function. These symptoms can significantly impact your daily routine and overall well-being. One of the most common indicators is the frequent need to urinate, especially experiencing this urge multiple times throughout the night, disrupting your sleep cycle, a sense of urgency, making it difficult to postpone going to the bathroom, and a weak or interrupted urine stream, where the flow starts and stops intermittently. You might also feel like your bladder never fully empties, even immediately after urinating, or experience dribbling after urination, which can be both inconvenient and bothersome. These symptoms, when combined, can significantly disrupt your sleep patterns, impact your performance at work, and generally affect your daily life and activities. For individuals experiencing mild symptoms, doctors often recommend a period of watchful waiting. This involves carefully monitoring the symptoms with regular check-ins and consultations with your healthcare provider. In addition to medical observation, simple lifestyle changes can often provide relief, such as reducing your fluid intake in the evening, particularly before bedtime, avoiding or limiting the consumption of caffeine and alcohol, as these can irritate the bladder, and incorporating bladder training exercises into your daily routine to improve bladder control. If symptoms persist or worsen despite these measures, various medications are available to help manage BPH. Alpha blockers work by relaxing the muscles in the prostate and bladder neck, which can lead to easier urination and reduced strain. On the other hand, 5-alpha reductase inhibitors function by gradually shrinking the size of the prostate over a longer period. In more severe cases of BPH, there are several minimally invasive procedures available, such as urolift or RxLinguistics, or surgical interventions like TURP, transurethral resection of the prostate, which can effectively relieve the obstruction caused by the enlarged prostate. The most suitable treatment approach will depend on the specific nature and severity of your symptoms, as well as your individual preferences and overall health. It's crucial not to ignore any potential symptoms of BPH. Early diagnosis and management of the condition can lead to significantly better long-term outcomes. Therefore, it's essential to have an open and honest conversation with your doctor to determine the most appropriate course of action for you. BPH is a common condition that affects many men as they age, but it's important to remember that you don't have to simply live with the discomfort and inconvenience it can cause. Modern treatments are highly effective in managing BPH and can significantly restore your quality of life and overall well-being. Taking action early and seeking appropriate medical care is key to achieving the best possible results and maintaining a comfortable and fulfilling life. Now let's talk about prostatitis, an inflammation of the prostate. Unlike BPH, prostatitis can affect men of any age, even in their 20s and 30s. It can come on suddenly or develop gradually, often mimicking other urinary issues. Sometimes it's caused by a bacterial infection, but most cases have no clear cause. The main symptom is pain during urination in the groin and lower back, or even during ejaculation. You might also notice urinary frequency and urgency. Acute bacterial prostatitis can cause severe symptoms like fever and chills. Seek immediate care if this happens. Diagnosing prostatitis involves exams and tests to rule out infection and inflammation. Treatment depends on the cause: antibiotics for bacterial cases and symptom management for others. Chronic cases may require a combination of medications and lifestyle changes. Understanding prostatitis is key to finding relief. Prostatitis comes in 4 main types. Acute bacterial prostatitis is rare but serious. Sudden pain, fever, and chills require immediate antibiotics. Chronic bacterial prostatitis causes recurring infections and discomfort, treated with longer courses of antibiotics. The most common type is chronic prostatitis or chronic pelvic pain syndrome, CPCPPS, where pain and urinary symptoms persist but no infection is found. Treatment for CP-CPPS focuses on symptom relief, anti-inflammatories, muscle relaxants, and sometimes alpha blockers. Lifestyle changes like warm baths, pelvic floor physical therapy, and stress management can help. Asymptomatic inflammatory prostatitis is found by chance and usually needs no treatment. Managing chronic prostatitis often requires patience and a multifaceted approach. If you have persistent pelvic pain or urinary symptoms, see your doctor. Relief is possible with the right plan. Don't ignore ongoing discomfort. Help is available. Understanding your type of prostatitis guides effective treatment. Now let's address the most serious condition: prostate cancer. Prostate cancer is common, but often silent in its early stages. No symptoms until it's advanced. That's why regular screening is so important. When symptoms do appear, they may include trouble urinating, blood in urine or semen, or pain if the cancer has spread. Most prostate cancers grow slowly, but some are aggressive. Determining how aggressive the cancer is guides treatment. For slow-growing cancers, active surveillance, regular monitoring without immediate treatment, is often best. For aggressive cancers, prompt treatment is crucial. Early detection saves lives. Don't wait for symptoms. Know your risk and get screened. Since early prostate cancer rarely causes symptoms, knowing your risk is vital. Age is the biggest factor. Risk rises after 50, and most cases are in men over 65. Family history and genetics matter. If a close relative had prostate cancer, your risk is higher. African American men face greater risk and more aggressive disease. Screening uses the PSA blood test and digital rectal exam, DRE. Neither test is perfect, but together, they're our best tools for early detection. When to start screening depends on your risk. Average risk at 50, high risk at 45, and very high risk at 40. Talk to your doctor about the pros and cons of screening. Shared decision-making ensures the right plan for you. Early detection means more options and better outcomes. Don't skip this conversation. It could save your life. If screening suggests prostate cancer, a biopsy confirms the diagnosis. A pathologist examines tissue samples and assigns a Gleason score to grade aggressiveness. Imaging tests may follow to check if the cancer has spread. Treatment depends on the cancer's stage, your health, and your preferences. For low-risk cancers, active surveillance is often recommended. For cancers needing treatment, options include surgery to remove the prostate or radiation therapy. Both are effective but can have side effects like incontinence or erectile dysfunction. Advanced cancer may require hormone therapy, chemotherapy, or newer targeted treatments. The field is evolving, with more options than ever. Work with your doctor to choose the best path. Personalized care leads to the best outcomes. Let's recap the essentials. Your prostate is small but crucial. Understand it to protect your health. BPH is a common, non-cancerous enlargement that causes urinary symptoms but is highly manageable. Prostatitis is inflammation, often painful, and can affect men of any age. Treatment depends on the cause. Prostate cancer is the most serious, often silent early, but very treatable if caught soon. Know your risk factors: age, family history, and race. Don't ignore new or worsening urinary symptoms or pelvic pain. Talk openly with your doctor about changes and screening. Early action and shared decision-making are key. Don't let embarrassment or fear keep you from seeking help. Take control of your prostate health. Informed choices lead to a longer, healthier life. That's a goal every man should strive for. Thank you for spending your precious time with us. Don't forget to check the description below to access other useful resources to accelerate your next medical language acquisition. Also, if you learned something from this video, hit the like button, share, subscribe to the channel, and hit the notification bell. Again, thank you so much.